Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. We often talk about the health problems in the under 5 children, the women of reproductive age group, including the antenatal or pregnant mothers, as well as the lactating mothers, and even the geriatric or old age population. But we often ignore the adolescent age group. This is the most important, if not the most important, transition period in any person's life. And there are so many health problems which are present during the period of adolescence. So in today's discussion, we are going to talk about adolescent health. What is adolescence? This is the phase of human development and it ensures the transition from childhood to adulthood. So every person who has become adult has gone through the period of adolescence. If we look at the origin of the word, it is derived from the Latin word adolescere, which means to grow into maturity. Who are the adolescents? So what age group is considered as adolescents? According to WHO, the age group of 10 to 19 years is considered as adolescents. But ICDS or Integrated Child Development Services says that 11 to 18 years is considered as adolescence. But for our general discussion, we shall consider 10 to 19 years as adolescence. There are some other age groups that we should also be aware of. For example, early adolescence is 10 to 13 years. Middle adolescence is 14 to 16 years, whereas late adolescence is 17 to 19 years. So we can see this adolescence age group can be further subdivided into early, middle and late adolescent. We also have youth who are the 15 to 24 years and young population belonging to 10 to 24 years. So basically adolescent as well as youth include the young population. What are the different features of adolescent health? We know that this is the transient phase of life, and that is why there is requirement of nutritional, educational, counseling, etc., and also guidance so that they become or they develop into healthy adults. In adolescence, there is physical maturity and sometimes psychological and social maturity. But remember, the physical maturity comes first and it is followed by psychological or social maturity. That means even before the appearance of social and psychological maturity, there can be appearance of physical maturity. Reproductive capability is now established at an early age than in the past. Also, adolescents are less vulnerable to disease than the very young and the very old people, health problems specific to their age group. If you see, most of the health problems, especially the infectious diseases, communicable diseases, they are very much common in the old age population. Also, the infectious diseases are very common in the young population, under 5 children, infants, etc. Adolescents are as such less vulnerable to these diseases. So what we do, we often forget that even in adolescence, they can have certain diseases. And because of that, we often ignore this age group when it comes to the health promotion, health protection, etc. Why is adolescent health so much important? We already said that there is major physical, psychological and behavioral changes in this age group. There is sexual maturity and onset of sexual activities. Especially during late adolescence, there may be some sexual activities. If we go back about 50 years from today, or 50 to 60 years or 100 years from today, girls used to get married at the age of 10 years or even earlier. So as you can see, it was quite common for them to have children when they were about 10 years, 12 years like this. So sexual activity during adolescence is not a new thing. Development of adult mental process and adult identity. So this is the time period when a person, an adolescent, starts to think himself as a grown up person. He does not consider himself to be a child anymore. He thinks I am getting older and I am growing up, and this adult mental process and adult identity develops during this adolescence time period. They are the future parents, so there is also importance of healthy responsible parenthood, great human resource for the society, because these adolescents will soon grow into adults, and adults are the human resources. So in that sense, adolescents are the resources for the future. Growth spurt and physical activity, menstruation. There are a lot of health issues related to menstruation in the girls, as well as pregnancy in this age group. Now let us talk about the status of adolescence in India. We shall look at some of the figures, some of the tables that will give us some idea about what is the health status of the adolescents in our country. India has the largest adolescent population in the world, that is 253 million. And in India, every fifth person is an adolescent, that is in between 10 to 19 years. About 43% of the girls drop out before completing secondary education, which means they do not complete class 10. And what are the reasons behind this dropout? That include the household responsibilities, marriage, child labor, limited relevance of education for employment and employability, which means sometimes the society, the families think there is no point getting a girl admitted in a school, or in even letting them complete their education because very soon they will get married and they will be a property of the other family where she is getting married. So that is why they do not want to spend any money for the education of the girl child. Other problems include distance to the school and or lack of sanitation facilities at the school. So maybe there is no girls toilet. So because of lack of privacy, girls do not want to go to the school, and that is why you can have high dropout, which is about 43%. At least 49.3% of the girls in India use cloth rather than disposable sanitary napkin. So here is another menstrual hygiene issue. Rather than using disposable sanitary napkin, almost 15% of the girls in India are using cloth, which often are not sanitary. The estimate suggests that each year at least 1.5 million girls, that is 15 lakh girls under the age of 18 years get married in India. So we can see there is teenage marriage, early marriage, and this can also lead to teenage pregnancy sometimes, which make it home to the largest number of child brides in the world, alone accounting for 1/3 of the global total. So as you can see, there is a huge burden of early marriage among girls in our country. Now this table shows the level of schooling, and you can see 10 to 14 years and 15 to 19 years, 2.7% and 4.3%. So approximately 7% of the girl child do not have any schooling. Now 7% does not sound very huge as compared to the 93% who has schooling, but if we calculate the 7% in absolute numbers, that will be a huge number considering the huge adolescent population in our country. Even for males, there are significant proportion of boy adolescents who do not have any schooling experience, but the percentage is higher among the females. Population 15 years and above who currently drink alcohol. So in the late adolescent period, there is 0.3% of the girls and 1.9% of the boy adolescents have alcohol consumption history. The proportion is much higher in the boys, but again if we calculate in numbers, it will be a huge number. Also, this practice is a little bit higher in the rural population as compared to the urban population. Same thing with the use of tobacco. The prevalence of tobacco use among the boy adolescents is much higher than the girls. Also, it is higher in the rural population. Next, let us talk about the awareness regarding the different contraceptive methods among the boys and the girls. 15 to 19 years, that means the later half of the adolescent period, have been considered for this particular survey. If we look at the table, we shall see a significant proportion of the adolescents are aware of different contraceptive methods, which include the male and female sterilization, that is the vasectomy and tubectomy, the oral contraceptive pills or hormonal pills, intrauterine devices, injectable preparations, male and female condom, emergency contraception, lactational amenorrhea method or LAM, and other methods. The percentages are little bit higher among the boys as compared to the girls. Let me tell you something here. All these tables that I have been showing, and I shall show in the next few slides also, they have been taken from the NFHS 5 2019 to 21 data. This report is already available all over internet. You can search by 2019 to 2021 NFHS 5 record, and you can also see these tables all by yourself. Now, even though the significant proportion of the adolescents are aware regarding the contraceptive use, let us look at their practices. If we look at the data for India as well as West Bengal, because this is the state I belong to, women aged 15 to 19 years were already mothers or pregnant at the time of survey, and this was 6.8% of them, which is a huge number, right? This is for NFHS 5. In NFHS 4, this was 7.9%. Of course, the percentage has decreased, but 6.8% adolescents in this age group 15 to 19 years were either pregnant or mothers during the time of survey. That is a huge number. If we look at the same data for the West Bengal, it was 16.4% in NFHS 5, whereas it was 18.3% in NFHS 4. Again, the percentages have decreased, but this is still a huge number. 60.4% is a huge number. Another question is adolescent fertility rate for women age 15 to 19 years is 43. Earlier it was 51 in NFHS 4. This is for data of India. Again, there is decrease, but it is quite high. Same thing for West Bengal. It was earlier 90. Now it is 81. So of course you can see there is a little bit decrease in pregnancy or fertility data, but the number is still huge, even though there is adequate knowledge or awareness among them regarding the contraceptive use, as evident from this slide. Coming to the next slide, that is number of children ever born at the time of survey. So this is about 4.5% who had at least one up to 3 children at the time of survey. So 4.5% of the total adolescent girls belonging to 15 to 19 years is again a huge number. What type of menstrual protection these girls are using? 49.3% are still using cloths. This is something I already mentioned earlier. Sanitary napkin is being used by 64.5%. If you add these percentages, that will be more than 100%. This is because this is multiple responses. Because a girl who uses sanitary napkin can also use cloth sometime. So she will opt for both sanitary napkin as well as cloth. So that is why we can say that 49.3% of the girls use cloth as well as 64.5% of the girls use sanitary napkin. So a huge proportion of the girls are still using cloth, which may be insanitary, and that can also lead to lots of infections. Now let us talk about the different health problems in the adolescent age group. The first is the nutritional problem. Undernutrition is a major problem in this age group. There can be iron deficiency anemia, mostly because increased requirement, because they are growing up now. There is increased physiological demand. There is also menstrual loss among the adolescent girls and dislike for iron-rich food. Not many of us like to eat green leafy vegetables or other iron-rich food, and because of that there can be iron deficiency anemia. Also frequent dieting, because the adolescents are very much conscious about their body weight, the body image, and they go for frequent dieting. So all this can lead to iron deficiency anemia. Sometimes there can also be obesity, especially in the rural population. In the metropolitan cities, it is quite a common problem. Eating disorders can be there, like anorexia nervosa, bulimia nervosa, and binge eating. So these are all the nutritional problems. Different reproductive problems can include teenage pregnancy, unsafe abortions, reproductive tract infection, urinary tract infection, irregular menstruation, and acne. Acne, even though it's not a reproductive problem, but it is somewhat related to the hormones, and that is why I have included it in here. I should like to talk a little bit about unsafe abortions. Because of lot of unprotected sexual activities in the adolescent age group, many of them become pregnant, these girls. Now they do not want their parents or family members or even their neighbors to know about their pregnancy. Of course, this is a big thing in our country. So that is the reason they do not go to any hospital, government hospital, because every time they go there, everything will be documented. So all these things being documented, there is high chance that their parents or family members will know about it. So they would rather go to the informal doctors, the quacks, the local physicians who have no medical degree, no medical training. Rather they conduct these unsafe abortions, which can lead to lots of complication during this adolescent age group. So this is a huge problem in this age group. Sexually transmitted diseases including HIV/AIDS, syphilis, gonorrhea, chlamydia, etc. can occur. Mental health issues are quite common and often ignored, which include depression, anxiety disorders, mania, psychosis, conduct disorders, and suicide. Behavioral problems can include drug experimentation, substance abuses like tobacco, alcohol, illicit drugs. So, smoking, alcohol drinking is quite common, and we often see on almost daily basis among the adolescents. Risk behaviors can include weapon carrying, rash driving. So because of their no care attitude, they do not care about anything, and also because of this age group, the hormone surge, etc., they follow these risk behaviors. There is also a problem of violence, bullying, etc. Social problems can include school dropout, low female literacy that I already explained in my previous slides. Child labor can be there, early marriage, and teenage pregnancy. Now the question is, what is child labor? Now this definition has been taken from the Indian Labour Organization or ILO data. The term child labor is often defined as work that deprives children of their childhood, their potential, and their dignity, and that is harmful to physical and mental development. And it says the minimum age at which a children can start work should not be below the age of compulsory schooling, and in any case not less than 15 years. So before the age of 15 years, any child cannot be involved in any kind of work, and it does not matter whether that work is paying or non-paying. That means whether the child or the adolescent, better to say, is receiving any salary or remuneration for his work. It does not matter. If the age of the child or the adolescent is less than 15 years, he or she cannot be employed. This is child labor. What about school dropout? School dropout is when a child or even adolescents in the age group of 6 to 14 years remains absent from school for 3 consecutive months, but there is no vacation and there is no certified illness. In that case, it is known as school dropout. Of course, if there is vacation, that means the child can be absent for a long time, maybe for 3 consecutive months, or if there is a certified illness of long duration, maybe the child had to undergo some kind of surgery, or there is some chronic medical issue. In that case, the child may be absent from school for 3 consecutive months. Even then, this will not be considered as school dropout. Otherwise, 6 to 14 years age group absent from school for at least 3 consecutive months is considered as school dropout. Next, let us talk about some of the health programs which are available for the adolescents and they include the RKSK, that is Rashtriyo Kishor Shasthya Karyakram, Adolescent Friendly Health Clinic, Weekly Iron and Folic Acid Supplementation, Menstrual Hygiene Scheme, School Health Program, RMNCHA, and Peer Education Program. The Rashtriyo Kishor Shasthya Karyakram or RKSK was launched in the year of 2014 on 7th January. So it has been 9 years since then. The different aspects of adolescent health which are considered under RKSK are sexual and reproductive health, nutrition, injuries and violence, including the gender-based violence, especially against the girls, non-communicable diseases, mental health, and substance misuse. Now, the system, the healthcare delivery system, where the Rashtriyo Kishor Shasthya Karyakram or RKSK, all these services are provided, is known as Adolescent Friendly Health Clinic or AFHC. Earlier in the year 2006, under the RCH2 program, the Adolescent Reproductive Sexual Health or ARSH Clinic were launched, or this initiative was taken, and the purpose was to provide counseling on the sexual and reproductive health issues, hence the name Adolescent Reproductive and Sexual Health. But we saw earlier that RKSK, along with the sexual and reproductive health, also considered the other important aspects of adolescent health, and that is why this name was changed from ARSH Clinic to AFHC, that is Adolescent Friendly Health Clinic, where the Adolescent Friendly Health Services or AFHS are being provided. These clinics are present in the primary health centers, community health centers, district hospitals, and different medical colleges, and the different medical officers, auxiliary nurse, midwives, counselors that are present in these AFHCs are providing the services, and they are specially trained for these services. The different clinical and counseling services which are provided from the AFHC under RKSK are the same that we already learned earlier: sexual and reproductive health, nutrition, substance abuse, injuries and violence, including the gender-based violence, non-communicable disease, and mental health. If you look at this list, you will see not many infectious or communicable diseases are included here, except the sexual and reproductive health, where some of the sexually transmitted infections are also covered, but the other infectious diseases are not included in the RKSK, because in this age group, these health problems, the different infectious diseases are not as common as they are in the early age group or even in the adolescents. I'm sorry, in the elderly or geriatric population. Next is WIPS, that is weekly iron and folic acid supplementation. We know that iron deficiency anemia is a huge problem through all age group, and that is why the initiative of Anemia Mukt Bharat has been taken few years back. In the adolescent age group, what we do is we give the weekly iron and folic acid supplementation. So every week the adolescent receive 1 tablet of iron and folic acid, which include 60 milligram of elemental iron and 500 microgram of folic acid. Also, there is biannual helminthic control by albendazole 400 milligrams. So every 6 months, the adolescent will receive 1 tablet of albendazole 400 milligram. This is WIPS. This is what the sugar coated blue colored IFA tablet looks like, and this is the albendazole 400 tablet. This is the blue color tablet. If we talk about the IFA tablet in the women of reproductive age group, then that tablet is red colored. So that is how you differentiate between the IFA tablet for adolescents and the women of reproductive age group. Coming to the menstrual hygiene scheme, it was initiated in the year 2011, and the objectives include to increase the awareness among adolescent girls on menstrual hygiene, to increase the access to and the use of high quality sanitary napkin, to adolescent girls in the rural areas, and also to ensure the safe disposal of sanitary napkins in an environmentally friendly manner. So basically we want to generate awareness among the adolescent girls, and also to ensure that they have access and they also use the high quality sanitary napkin, and also know how to dispose this sanitary napkin in an environmentally friendly manner. In the rural areas, ASHA, they distribute this sanitary napkin, and each pack of this sanitary napkin contains 4 pads, sanitary pads, and each of them cost only 1 rupee. So basically a pack of 4 sanitary napkins cost 4 rupees. If one Asha can sell such a packet of 4 sanitary napkin, she will receive an incentive of rupees 1, and also a free napkin for every month for her personal use. And earlier these sanitary napkins were distributed under the name of free days, but now they are distributed under the name of Suvidha. This is the Jana Aushadhi Suvidha initiative. School health and awareness program was launched in the year of 2020 in the month of February. We know about the school health program. This is the same thing. This is being implemented in government school as well as government aided school, and from each school 2 teachers are identified, preferably 1 male teacher and 1 female teacher, and they are designated as health and wellness ambassadors. Now, what are the different activities or services under school health program? They include the school health promotion activities, which are age appropriate incremental learning for promotion of healthy behavior. There is also health screening. So that means these ambassadors, this male and female teacher who are trained, they can identify or screen 30 health conditions. Remember, they do not diagnose, they just screen. And there are 30 such health conditions that they can screen, and then they will obviously take the adolescent to the nearest healthcare center where the further management will be done if needed. Provision of different services including WIPS, that is the iron folic acid, as well as albendazole. Also provision of sanitary napkin and age appropriate vaccination. Electronic health records are to be maintained, and imparting skill of emergency care, like training of other teachers on basic first aid. This is the age appropriate health promotion. So different things are to be taught to children or adolescents of different age group, right? So that is why these are the things to be told to the primary school going children. These are the thing for the middle school going children, and these are the thing for the adolescents going to the high school. This is the list of 30 identifiable conditions that can be screened by the health and awareness ambassadors. There are 30, you can see the numbers. You can pause the video here and you can read the whole list. Next is RMNCHA, that is reproductive, maternal, newborn, child and adolescent health. As you can see, there is an adolescent segment, and the initiatives or interventions for the adolescents include to address teenage pregnancy and increase contraceptive prevalence in the adolescent to avoid the teenage pregnancy. Introduce community-based services through peer educators. So peer education we shall talk about next. Strengthen the ARSH clinics, that is Adolescent Reproductive and Sexual Health Clinic, which has been renamed to Adolescent Friendly Health Clinic or AFHC. Roll out National Iron Plus Initiative, now known as the Anemia Mukt Bharat, including the weekly IFS supplementation. So basically WIPS, and promote menstrual hygiene. So menstrual hygiene scheme, MHS. So all these things we have discussed already except the peer education. The minimum essential commodities for the adolescents include the tablet of albendazole for the deworming, biannual deworming, tablet dicyclomine for the menstrual spasms, as well as RTI and STI kits. Along with that, there is also need of iron and folic acid tablets, some of the antibiotics which are included in the RTI STI kits already, etc. etc. Peer education program. and this program stands on the concept that an adolescent will be more comfortable discussing his or her problem to someone of his own age group, that means another adolescent, someone he or she knows, than to talk to someone he does not know, maybe an adult person. So what we do here, the Asha in any village, she selects 4 peer educators. These peer educators or PE are also known as Sathiya. So how these PE are selected? From the school going adolescent, 1 boy PE and 1 girl PE is selected by the Asha. And the adolescents who do not go to the school, among them 1 boy PE and 1 girl PE is selected. So now we have 2 boy PE and 2 girl PE. They are the peer educators or the Sathiya. There are some responsibilities that is given to these peer educators. They also receive some trainings so that they can teach the other adolescents regarding the different health problems. That means they can discuss with them and try to solve their problem, or at least they can inform the Asha or ANM for further steps. These are the different roles of peer educators or Sathiya. First of all, each peer educator will form a group of 15 to 20 adolescents. So a girl P will form a group of girls, whereas a boy P will form a group of boys, and each group will contain 15 to 20 boys or girls. It cannot be a mixed group. It will be exclusively boys group or girls group, because sometimes if boys or girls are together in a same group, they may not be very comfortable discussing their problems. Next is, they organize weekly and monthly peer education session. This is when the peer educators sit with the other boys or girls in this group, and they discuss among themselves the health problems, and they impart some of the education to the other adolescents in the group that will help them. Actively participate in monthly AFHC meeting, that is adolescent friendly club. This is where the peer educators, these people, these guys, they get education, they get training, because they have to conduct all these things and they have to arrange and perform the educational sessions to the other adolescents. So they themselves need some kind of training. This is done in monthly AFHC meeting. They also support the ANM for organizing Adolescent Health Day in the village. So all these are the different activities or responsibilities of the peer educators or Sathiya. So this is about the peer education. With this we conclude today's session. Today we have learned who are the adolescents, what are the different adolescent age groups, that means the sub-classification. We learned about the importance of adolescent age group, the different health problems in this age group, and the current scenario of adolescence in our country. And finally, we talked about some of the programs or services which are available for the adolescents in our country. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends from other colleges. You can also follow our Facebook page. The link is given in the description. Take care, and we shall see you in our next video.